World TB Day is commemorated each year on March 24 to raise public awareness on the devastating health, social, and economic consequences of tuberculosis and to step up efforts to end the global TB pandemic. Speaking at the commemoration, the Deputy Director of Health Services at the Ministry of Health, Mamadou Nyasi, discussed the gains made in the fight against tuberculosis and HIV.
Tuberculosis is one of the commonest opportunity infections among people with HIV. In order to improve the quality of life of people with HIV co-infected with TB, it is necessary for them to have access to treatment of TB. The National AIDS Secretariat program data for 2020 shows that a total of 18,540 people with HIV, this includes those on treatment, the newly diagnosed, the positive pregnant women, were all screened for TB in an effort to improve the collaboration between the TB and the HIV program, as both are correlated. Efforts to improve collaboration between TB and HIV at both policy and program levels have registered great success.
The WHO country representative, Dr. Nesta Turini, highlighted some of the key challenges faced in the fight against tuberculosis.
TB is still a problem that we have to solve. That's why we are coming again and again to remind ourselves. Because it causes a very devastating consequence, particularly in developing countries. And we must acknowledge also the significant achievements, however, that we have made in the fight against preventable diseases, not only TB, but other preventable diseases. This year, we are making a significant progress in this regard, but we are calling still for more efforts. And that's why the partners have agreed to use this theme. We can end TB. Let's continue fighting TB.
The African Union Commission representative Whitney Wanjuku Manjagi calls for concerted efforts to end tuberculosis in Africa.
The African Union Agenda 2063, which envisions an African-led transformative push to ending diseases and really strengthening our communities to contribute to the larger development agenda. We also have the Africa Health Strategy, which is up to 2030. We also have the catalytic framework to end AIDS, TB, and eliminate malaria in Africa again by 2030. For us, really urgent need to intensify efforts. We've talked about mobilization of resources and upcoming opportunities to make sure that that is in line.
The event was meant to sensitize people on the effects of tuberculosis and the need to decrease the burden on TB, particularly on people living with HIV, as well as subsequent elimination of the disease. For GRTS News, this is Yerro reporting.